this is Urban Health Today, and I'm speaking with Dr. Daniel Van Hoff, a professor in the Department of Medicine at City of Hope and distinguished professor at Translational Genomics Research Institute, or TGen, which is part of City of Hope. And we're talking about the $150 million Stephenson Prize for advancing pancreatic cancer research. Thanks so much for speaking with me today, Dr. Van Hoff.
My pleasure. Thank you.
It's an honor to have you. All right, let's begin. Could you explain what the Stephenson Prize is and how it will stimulate innovation in pancreatic cancer research?
Well, the Stephenson Prize and Stephenson donation has several aspects to it. One is a prize for a research team or researcher who has done outstanding work in the area of pancreas cancer that will have an impact on patient care. So that's one aspect. And then there'll be really competitive for anybody in the world to receive grants for innovative research, be called a fellowship program. And there's also a part of the donation that would go to a tumor bank that one could tap into for early detection methodologies, et cetera. So it has several aspects, and there's also, I believe, a yearly meeting that we put together for the fellows who are successful in getting these grants to increase the collaboration. So those are basic components.
So do you have the Stephenson Prize and the Stephenson donation, or is it the Stephenson Prize broken out into all these parts?
The Stephenson donation broken off into those parts.
Including the Stephenson Prize?
Correct, correct.
Thank you for clarifying that. What does receiving this level of support mean to you and to your team of researchers?
I think to the field of trying to make advances for people with pancreas cancer, number one, it's awareness is really critical. I'm old enough to have seen the impact that awareness has in areas like breast cancer and other areas of cancer. So pancreas cancer has been a tough area because it's diagnosed very late. So awareness is number one. And just the announcement itself, or doing things like we're doing right now, is important because sometimes it's posted on a refrigerator or somebody sees it online and they say, you know, my husband or my wife has been complaining about some pain. Maybe we ought to be seen. So awareness is number one. Number two, it's been an area that hasn't had much attention before in terms of funding. And if you're trying to get investigators to work in an area, they need the resources in order to be able to do the work. It also shows that we might be in a time now that we have the technologies to actually go after this tough disease. So I think the number one message here is awareness, and somebody is really caring to recruit these young investigators or established investigators into an area that has resources to get the work done.
I wonder how much of this prize came out of the new guidelines, well, relatively new guidelines for screening BRCA1 and 2 carriers, gene carriers, starting at age 50 for pancreatic cancer. Did that have any relation to it, or?
I think we know that the best way to cure the disease is catch it early. There's no doubt about it. But actually, inheritance of as far as we know, pancreas cancer is only about 16% of people. BRCA is one risk gene, there's no doubt about it, but the other 84% of people, how do they get it? So the answer is awareness of risk factors is really a critical piece of this prize and what the risk factors are. And it's going to generate a lot of interest and projects in early detection. And as you know, early detection is the way to really cure the disease. And we've gone through this with mammograms, pap smears, colonoscopies, and it has a gigantic impact. So BRCA has been one aspect, but there's at least 16 genes known to be associated with pancreas cancer. And every year, there are new ones that are being developed. So yes, that's going to be one aspect of it, is discovery of these risk factors.
So what areas of pancreatic cancer research will the gift specifically cover? Will it fund clinical trials, drug development, early detection?
All areas. We're relying on the creativity of investigators, but certainly early detection and treatment for patients who need it now are two great areas of emphasis. So I think that's what's very special about it. There's no limitations as to where it should be done. It's where are the best ideas against the disease. And it's going to be very, very interesting to see the ideas come in and what people's thoughts are. And we need that kind of innovation against the disease. I would point out one other thing is that every cancer in the last 40 years has an improvement in survival, every single one. But what our worry is, and the timeliness of this prize, is that in another 3 years or so, pancreas cancer is going to be the #2 cause of death from cancer in the United States and soon the world. And that's because other cancer types, many more cures. But this is going to be #2, and that's what worries all of us. And also, it seems to be developing in younger people also, particularly younger women. And that's scary to all of us.
Well, so pancreatic cancer also disproportionately affects Black Americans who are often diagnosed at advanced stages. So how will the funding help address these disparities in diagnosis and treatment?
Well, it's going to help us identify risk factors. And the risk factors are usually, first of all, family history is one, as you pointed out. #2, smoking is a big risk factor. Diabetes, which disproportionately affects African Americans and other folks. There's other things, though, that are really very curious. For example, tall people, regardless of race, have a higher incidence of pancreas cancer and other cancers, by the way. And something that may be not so straightforward, but it just turns out that tall people have more cells at risk. That's just kind of a recent finding. So no matter what country or your race, tall people have a higher risk of cancer. So we're trying to figure that out. And there are many, many other risk factors. We worry about environmental and others, which are undefined. And a gift like this gives people a real chance to have the funds to study those things. The goal here has to be, who should we be looking at as very high risk? And I think, one of your other articles on AI that you've done, which was really interesting in the various aspects, is you've taken all of these risk factors, and there's at least 35 of them, even your blood type, to try to come up with your risk profile. So is Dan going to develop pancreas cancer? Let's get him tested with a blood test. Right? And we haven't narrowed that down yet, but there's many risk factors. Race is one, but the question is why, right? And it seems to be that maybe a higher incidence of diabetes is a good example of one.
Can we circle back to your point that in 3 years, pancreatic cancer will be the #2 cancer? Do you not have hope, or do you have hope that with this prize and the research that you and your investigators are doing, that maybe that won't happen? Or is it for certain going to happen?
Well, we have hope it's not going to happen. I think the only important part there is early detection is going to help. But I think because other tumor types are being cured so much more, right? And one of my old bosses used to say, you got to be alive to get the second one, right? So there's no doubt that having a prior cancer is a risk factor. And I'm afraid that this is marching on, and the advances won't come in the 3 years, but the awareness will. So, for example, we might be able to stem the tide by something like this gift, which is awareness. And people are going to say, yes, I've had some of these symptoms, and I better go in and get checked. And if you have early pancreas cancer, we call it stage 1 or stage 2. Stage 1, you have an 85% chance of surviving, 85%. Whereas if you have stage 4, then the numbers go down substantially, as you know, into the single digits or teens. So I'm hoping that just these kinds of announcements will make a difference. And I think both of us have seen that happen in breast cancer. Right. Somebody, many women said enough is enough. And Department of Defense funding went into it. Susan Komen Foundation, so many foundations said enough is enough. And that turned the tide. That's in my lifetime, turned the tide for awareness of breast cancer and survival so much. So I think awareness is the first step. And this is an awareness prize too.
Well, I'm just curious how, yeah, this is a tough one because how do you decide? Because you asked the question, who do you look at? So then how do you decide who who gets early screening and early detection?
I think of patients have risk factors. So for instance, let's take family, for example.
Mhm.
So if your mother or father or sister or brother has pancreatic cancer, you're at a higher risk. No doubt about it. And so start there. And it's pretty interesting when a family member develops pancreas cancer, we often will say, well, how about your brothers and sisters? Especially, we know, Tamara, that if you develop pancreas cancer at a young age, less than 60, right? If I developed it at less than 60, I better have all my brothers and sisters, first degree relatives, please go in and get an MRI of the abdomen. And there's no radiation involved. Please get an MRI. Now, as a person, you want to make sure that even if you're affected, that your loved ones are not, or if they are, that you detect it early. And that's one thing I do find in practice is that when somebody develops pancreas cancer young, everybody should be thinking, what about their relatives? What about their relatives? Because you might save them from having stage 4 disease, and they probably are going to be curable.
So let's talk about early detection. What advancements in early detection and treatment do you anticipate achieving with the funding?
I'm hoping, by the way, just to let you know, there are a lot of people out there who are trying to develop them for everything from using blood to urine to saliva. And these are, and also, by the way, stool tests too, just like the Cologuard was developed, right? So lots of people are working on it. But as you might imagine, you have to have pretty large populations in order to do that. Pancreas cancer is not real common, which is good news. It is more common in African Americans. It's less common in Hispanics and Asian backgrounds. We do not understand those basics. So this will help. And part of the dollars from the Stephenson grant are certainly for a member set of pancreatic tumor bank, but that also is include normal. So right now it would be blood, but also collecting things like urine and saliva. We're looking for something pretty simple, right? That could be done by everyone because you catch it early, just like you catch breast cancer, it's curable. So this prize or this donation is certainly going to have a big component of people applying for funds and then having a bank of serum and other body fluids that you can readily test the new thing. That's really hard to come by and so important part of this gift.
And how many years away do you think that is before that's perfected? To use that term loosely, because I know science isn't about perfection.
Actually, I think that some of these tests will be available probably early next year. We're hoping, that
nice.
can be there. They're not the best yet. And you hit the nail on the head. None of them are going to be perfect. Our worry comes from two ways. If you have a negative test, are you sure that you're negative? And the second thing is, if you have a positive test, you've got to make sure that you're positive, right?
Right.
Because if you have pancreas cancer and it's surgical, that's a tough surgery to have. And you just got to make sure you're correct. So you got to be very stringent in the way you develop these. As you know, mammograms took a long time to show whether or not they were helpful. And it took, less radiation. And of course, now it's absolutely secure that they are helpful. Pap smears, all those things took too long, but that's what happens when you have a new diagnostic. You want to make sure in medicine, the number one thing is do no harm. All right, that's the Hippocratic oath. And we do worry about false positives. But I do think that in the next year or so, that the first ones will be coming out. There'll be pan cancer for all cancers. And we're hoping to see those improved, and then you'll see more people get the tests. They aren't going to be perfect, but that'll be a start. And of course, having a bank where you have, because for example, we worry about if you have diabetes, can you have false positive, right? And then if you have a positive blood test, but you can't find the cancer, what can you do? Those are all the worries that we have that's going to be easy for a person to do. besides lifestyle, which is easy to say, manipulations, right, but hard to do.
Correct. The
We
small
think
difference, though, between breast and female cancers and pancreatic is that there is the option to remove the organs versus with the pancreas, not so much.
it is hard, but I don't think that I've lived through the points, where the mastectomy, it's not easy to remove that organ either, let's face it. I watched the pioneers who said, let's just do a lumpectomy because you don't have to do mastectomies most of the time. You don't. It's a lumpectomy and chemotherapy and then usually radiation locally, so it doesn't recur locally, right? So it's not as often that mastectomy is necessary. So I watched that. Now, pancreas, it's true that it's tougher. In the tail of the pancreas, it is not, because that's easy to do just with a laparoscopic surgery, right? So if there's a tumor in the tail of the pancreas, it's much easier for the patient to have that taken out. If it's in the head of the pancreas where the bile ducts come through, that's a tougher surgery for a person to have and recover from. So there are technical differences between those two. And of course, our goal is to prevent it. Or if you have an early cancer, just is organ preservation. And that will come.
What is organ preservation exactly?
Well, for example, we know that the pancreas is important for insulin production, right?
Right.
So you can actually isolate. In fact, City of Hope is a pioneer in isolation of islet cells. They're the cells that make insulin, and actually being able to give those islet cells back to people. And that's one thing that's special about the gift to City of Hope, is they're such a great diabetes center, right? And it is a risk factor. It's a big risk factor for pancreas cancer, gigantic. So one of the other risk factors we should talk about is inflammation, because if you were born with having, we call it familial pancreatitis, in other words, you get bouts of inflammation of the pancreas, and you get 40% of people develop pancreas cancer. So in the AI algorithm, you'd put, have you had pancreatitis, right? And if you have been a heavy drinker, then you're going to have had episodes of pancreatitis, and the incidence is higher in people who are heavy drinkers. Smoking causes inflammation of the pancreas. So we think a common part of all the risk factors is inflammation. And a lot of people are working now on anti-inflammatories to try to prevent cancer. We know that if you take aspirin, you have a lower incidence of colon cancer, right? But you can't keep taking aspirin because it causes bleeding, as you know. 10% of people will get bleeding sometime in their lifetime if you constantly take aspirin. So these are all tricky, but doable. But we think inflammation is a gigantic issue.
So will this donation enable new collaborations between City of Hope and other research institutions to accelerate breakthroughs in pancreatic cancer research?
Well, number one, you'll have more people because of the dollars there. More people are going to be wanting to work in the area. That's what happened, as an example, in breast cancer. When people started putting the funds together, in addition to our National Cancer Institute, the number of young investigators getting interested in it just blossomed. And then they start presenting at meetings like the Stephenson meeting, right? The Stephenson meeting is going to have special meetings, and these investigators are getting together and exchanging ideas. And as you might imagine, it's docs and PhD investigators are very competitive, right? And we can use that to our advantage, that they want to present their best things. And if you hear somebody present, say, oh, I'm working in that area too. Pancreas cancer is so bad that the collaborations are easy. We know one person doesn't have the answer, and everybody knows it's a bad disease. And I find, having worked in this for a while, is that the people are super eager to share their results. And of course, if a team gets together, there is an opportunity to get the $1 million prize, right? You're not going to work together for the $1 million prize, for sure, but it's a matter of pride that you made a difference. That's what the prize is going to do. And it's helped in other areas of research.
I'm curious, are there any guardrails on the prize to make sure that the tissue samples are including diverse patient populations?
Oh, yeah, super interesting question. But the answer is, I suspect that that's a great interest. You know, why do Hispanic folks or Asian folks have a lower incidence of cancer, pancreas cancer? No one really understands. Why do African Americans? We can say, well, they have more risk factors. You know, that's one thing. But is there some other abnormality, one way or the other, or something that's positive? And we see that, for instance, children never, African American children never get neuroblastoma. And we don't know why. There's some protection. But it's just starting to crack it open. Native Americans, there's not much information at all in Native Americans as to incidence, et cetera. But we do know that another risk factor that Native Americans get more gallstones. Again, those gallstones cause inflammation, and it's a risk factor for pancreas. So everyone's going to try to make that tumor bank as diverse as possible to try to answer these questions. Well, especially because we see the disparities. The question is why, and then we would identify perhaps why. But if you don't have that diversity in your samples, you're not going to be able to answer that question.
Well, you talked about pancreatic cancer having historically suffered from a lack of funding. How will the donation bridge that gap? And what opportunities does it open up that were previously not available?
Well, as you might imagine, scientific discovery or clinical trials are very expensive. And investigators have to go to an area where there's funding. It's pretty simple. If you're going to devote your life to it, you have to have some support to do it. So in clinical trials, it's research nurses and data management, et cetera. At the bench, it's technology and reagents. So if you don't have funding, there's no way to go. So if breast cancer area has great funding, you're going to see the advances in that area because you have more investigators are able to work on it. And just, I think the funding level, if you apply to, let's say you have a very good idea and you put it into the National Cancer Institute, you have about 8% chance of getting funded. And we all wish we could do, have bigger amount of money there, but that's what it is. It's very competitive, which is good. But I think you and I would agree that probably there are more than only 8% of ideas that are really pretty good. And everybody who reviews these things said there are a lot of good ideas, more than 8%. More shots on goal are going to get you more advances, no doubt about it. So this really invigorates the field. And I'm old enough to have seen that happen in breast cancer and so many other cancers. Kidney cancer, lung cancer, look at incredible. And that's all been because people said, we're tired of this. And that's what I think this gift helps say, we're tired of these deaths.
Yeah, it's interesting that pharmaceutical industry and the government haven't kicked in adequate money for pancreatic research at a time where, as you pointed out, it's affecting younger populations. Just an observation. What's the
No, that's a good observation, I think. And the reason is that most of the discoveries will, first of all, come from academic institutions, right? That's where most of the discoveries, sometimes it comes from a great doc at the bedside, but the discoveries come from there. But taking it to the next stage, either a diagnostic or a therapeutic, that takes really large sums of money. So a gift like this gets the discoveries, right? But somebody else to take it to the next level. And even in that 8% that get funded, those things aren't applied clinically until you actually have, so let's say they discover a target, somebody's got to make a molecule against it. That's where industry really shines because they've got, gigantic libraries of chemicals, or they got giant of antibodies, to go after that target. So this kind of a gift gets the discovery. That's really, I think, critical. And then you can go ahead and try, the applications. City of Hope has been very good at that. Other places, okay, I got an idea for a vaccine, but who's going to have enough dollars to take to the next level that usually is a handoff to industry.
Right. So what's the projected timeline when patients might begin to see the benefits of the research funded by this donation?
Well, I think it's going to be in the first year. Just remember, if you get together people like
Wow.
this, yeah, and I'll tell you why is because you get together docs, and we're at a conference and say, I saw Mrs. Jones, and she was a young lady, and we found out that she had two sisters. Oh, is that right? Well, one was a twin, one was not. I'm just giving you an example, right? And here's what I did for that patient, and maybe you ought to try it. So, or somebody has a good idea, and you can, by that, you can just start looking and say, maybe I've got this great idea. That's the way Taxol came about, a really important drug for us, and we have a better way to deliver it. So I do believe that getting people who are, work in the area together generates immediate benefit.
And how will you measure the success and impact of the projects funded by this donation over the coming years?
More lives saved. That's what it is. And I think it's important, Tamara, to say, you read the literature, you look on the web, you say, well, it's a 13% 5-year survival, right? Remember, that's 5 years ago was the number. But let's just take that. Let's say that I'm diagnosed today, and I say, well, I have 13%. I have a 1 in 7 chance, right, of being alive at 5 years. Maybe I'll be that one. So number one is that if you don't try, we don't have a chance of helping. The other thing is that you got to be alive to get the next breakthrough, right? So even some of the drugs that we've helped develop over the years, we really want people to give it a try, because the field can change very fast. It can change from one day to another. I've seen it. So you got a new therapeutic, everybody's literally dying from the disease. One day, the next day, almost everybody's surviving. That's happened in leukemia. It's happened in testicular cancer in young men. So if you've been in the area long enough, these breakthroughs can make a big difference really fast. I could be one of the 7, and you got to be alive to get the next breakthrough is the way that we look at it. And we fight like crazy to keep that person going.
Well, forgive me for asking this, Dr. Von Hoff, but there's a difference between living with stage 1 and living with stage 4. Wouldn't you agree?
Of course, that's one of the things that we're going to be looking for, I'm sure, in some of the applications is what can you do in terms of quality of life, pain control, et cetera, et cetera. One of the great breakthroughs, Tamara, I think, in people taking chemotherapy has been the use of things to stop nausea and vomiting. I always say you should have none. You should have none. You just really have to keep insisting that I'm not going to go through this unless I can be living as close to normal life as possible. So there's no doubt there's a lot of people working in supportive care, not only here, but in pancreas, but also in other oncology areas. So yeah, there's no doubt that you want a person's quality of life is the best possible. No question about that. And I'm hoping that prize like this, there'll be some applications that come and say, hey, I'm going to fix this. But we got to be careful, this complicated area. Let's face it, daughters always take care of their fathers. That's why old doctors told me, Dan, make sure you have daughters. And I had 2 in case one hated me or something, just in case. So I got a spare. But it's true, they're at the bedside and they want what's best for dad. And I go through all that because, of course, we're super interested in quality of life. We also want them to get tested, by the way, if dad had pancreas cancer, right? But the quality of life is super important. And there's many people working on things to prevent the side effects, but also, psychologically, how can we handle this while we're doing it? I'm hoping to see many applications for this that particular thing, but we'd rather not have them develop the tumor in the first place, let's face it.
Well, how can patients, families, and the broader community get involved or stay informed about the advancements made possible by this gift?
Reading your publication is one. So I hope that you're able to follow this as the years go on. Not too many years, I hope. So I'm serious. You know, I've read your work, and it's important to get these advances out there. No doubt about it. I think number two is this is going to generate a lot of awareness. So if, as you read this, or anybody, and they're having symptoms, make sure that they're seen. Well, I don't know if I should say this, but my wife would call it nagging, but it's usually someone in the pair saying, you know, you really should be looked at. That's where the awareness comes in.
You know, you talked about breast cancer. Breast cancer has had a tremendous push in terms of involving all manner of doctors, from the primary care doctor right on up. Do you see that happening with pancreatic cancer in terms of primary care doctors, which are, you know, you got your NPs, you got your primary care doctors, you got your physician's assistants. These are these are the providers on the ground that are seeing people. Do you envision in the future some sort of campaign to raise their awareness as well, so that they can sort of pre-screen and pass these patients on?
Absolutely. You can see it starting in Alzheimer's, just as an example, you know, with the new scans and things and blood tests that are available. In fact, there was just a special edition of JAMA, How Do We Get Everybody Who's on the Front Lines, you know, to weigh in. Between you and I still think comes down from patients and families saying, hey, you know, I've heard about this new blood test for pancreas cancer or for Alzheimer's. Should I be considering that? And so I do still think that it comes from grassroots, meaning patients and their families. You know, Jim has been suffering now for the last couple of months, you know, with abdominal pain. We need to take that look at. Yeah, it still comes from, because everybody really needs to be, you and I know, taking care of number one, if we can do it, right? So that's a start, but there is great concern that with these advances that they're not early enough. Let me give you a specific example. So if somebody develops new onset type 2 diabetes, right? And all of us, I'm certainly at risk. Many African-American people are at risk. Type 2 diabetes is a scourge of our nation.
Correct.
Regardless of race, right? And you say, Dan, so if somebody develops type 2 diabetes, the doctors and everybody should be thinking, that's a risk factor for heart disease. It's a risk factor for pancreas cancer. And in 3 years after the onset of type 2 diabetes, about 1% of people will be found to have pancreas cancer. Right? So if I were in church or synagogue or mosque or whatever, you know, and I'd be saying, you know, anybody having type 2 diabetes, you ought to ask your doc, you know, just keep in mind that about in 3 years, 1% are going to develop pancreas cancer. Maybe with a blood test you ought to think about that, right? And we know that if your cholesterol is high, right? And well, I remember that was a tough sell in the beginning, very, very tough. I said, well, you know, it could be up for another reason, but if your cholesterol is more than 200, you probably ought to be on something to lower your cholesterol. And diabetes, you say, Dan, how is that a risk factor? It's inflammation. It causes inflammation of your blood vessels, right? It gives you obesity, and obesity causes incredible inflammation. So just the new onset of type 2 diabetes, because that's a specific example that if every internist, nurse practitioner, everybody thinks, you know, this is new onset type 2 diabetes, we got to be worried about that. We got to take care of that any way that we can. Is it a GLP-1 agonist? Is it weight loss, which is hard? What is it? And then number two, you know, I got to be thinking even bigger on that, just to make sure, hey, did your mom, let's go back over your family history again. Did they have, and how tall are you? So you're looking at all the other risk factors. But if I could say one thing, anybody that reads your publication says type 2 diabetes, have your doc think of some nuance at type 2 diabetes. Just bring up the idea, is that a risk factor for pancreas cancer? And the answer is, you bet it is. Let's get the antennas up.
I want to thank you so much for saying that about obesity being highly inflammatory, because so many providers are afraid to say that. And I think people really underestimate the effects of obesity, because it also, leads to a lot of, cancers and a lot of endocrine disruption and just a host of things. So just thank you for saying that. Thank you for saying that.
I appreciate you saying that. I've had to lose quite a bit of weight myself, so I know it's pretty hard to do, very hard to do, but it is a terrible risk factor, and it's a risk factor for so many cancers. And I think the amazing thing is, or the way we've really come to know about this more, is that people who have gastric bypass surgery, if you have gastric bypass surgery, and you had a real indication to have it, if you have it, guess what? First of all, your type 2 diabetes disappears, pretty much. Okay, the second thing is the incidence of cancer, you ready for this, goes down by 1/3 in 3 years. Just think about that. That means cancers might have been there already, but it goes down by 1/3 in 3 years. So it means that's gastric bypass. Now you kind of have the GLP-1s, which is, I wouldn't say gastric bypass in a pill, but pretty close, right? But that's really what was the seal that obesity, overweight was a driver of all these cancers. And you say, well, and we see it as young kids are certainly, or the cancer. I will say one bad thing: no matter it's colon or lung, these cancers in younger people are much more aggressive.
Yes.
They're much more aggressive.
Dr. Daniel von Hoff, thank you so much for your time today. I hope you'll keep us apprised of how the donation is making a difference in pancreatic research, because pancreatic cancer research needs more heroes like you tooting the horn and talking about it. So I hope you'll come back and let me know how that prize is making a difference. Because I
really appreciate you doing this. Your efforts, the awareness is really critical.